so relevant anatomy. So what we really do is all we do is make a little skin incision right here. Here's your oblique muscles. Here's your latissimus dorsi. And right in this interval here, poke a finger through that hole, and you work right in this space, and you're on the edge of the psoas. Never saw an implant become infected, so just for that reason, sparing the blood supply. When you reconstruct from the side and you really preserve all the soft tissue structures and you stay off the facets and the facet capsules in the back,
I would highly recommend that you encourage your surgeons to take the time before you start the case to really get that initial positioning correct. So basically we're going to talk about the positioning, the taping, the adjustments you make in the table, and the room setup. It honestly does make or break the case.
The Timberline system is a retractor and a series of implants, and the implants for lumbar interbody fusion range in length from 25 millimeters wide to 60 millimeters wide. They range in anterior to posterior dimensions. You can see it pulling the pelvis out of the way, and that's it. All that it takes is dropping the foot end a little bit, keeping the patient in the flat position. You can see when you do that, the circumferential tape loosens up a little bit. We like to add one more pass just to keep them set on the table. The reason that the patient is in a little bit of Trendelenburg is because when you pull the pelvis out of the way, the disc stays in parallel, but I always want to work directly from ceiling to floor. Just for completeness sake, our inferior impulses were about 15 or 14, anterior was 13. Second dilator, it works the same way, it's EMG activated, and same system. You want to come right to the opposite edge, and you just want to release the contralateral annulus. This is really the part that should be done with two people. It's very tactile feeling. The cob is on that edge.
These are the components of the retractor, the main body here, and then you have the handle assembly. You have the posterior handle and the cranial caudal handle. Okay, the posterior handle simply inserts into the back of the cranial caudal handle. There's two lines indicating whether it's fully loaded or not. And then you rotate the silver collar to one of the positions, and that'll determine if it's locked or not. And then, of course, we have standard curettes. We have these scrapers, both a box curette and plate scraper, and then kind of your standard run of curettes with multiple sizes. The osteotomes are there.